the only places being used as a safe haven for the victims of this disaster are classrooms, because we don't have community centers and others to even house them. So education has come to an end for all of these children who are there, and nothing has been done, no provision made for them to catch up on lost time. So that's also another issue that we'll touch on briefly. But Dr. Djokoto, I appreciate you staying with us, and also at least hearing from all the other panel members on the issues that they've been talking about. The concern about the health implications of this. We understand that over time, the flood water is said to be contaminated and giving off pungent smell. Is this the case?
Thank you very much. That is certainly the case. But before I proceed, kindly give me the opportunity to thank you for allowing me to engage on this very privileged and esteemed platform. And let me also use this opportunity to express the sympathies of the Director General of the Ghana Health Service, Dr. Patrick Abuaji, my Regional Director of the Health Service, Dr. Chrysanthus Kubio, Director of Public Health, Director ICD, who have also been on the ground. And it's also very appropriate that all the support that we have received from people, we acknowledge them. We acknowledge our health workers who've been on the ground for at least the past 10 days, and all those who prepared for this particular disaster over the past couple of months. Our surveillance officers, disease control officers, health promotion officers, our doctors, our nurses from the various facilities across the Tong areas and other districts. Let me also thank all the other collaborators who have been assisting from the Volta River Authority. They've been of great help to the health service. Let me also thank the district assembly. Let me thank the members of parliament. Let me thank the various political parties who have also come to support. The UN group has been there supporting. World Health Organization has been there supporting. Yeah, so to your question, yes, this is indeed true that in Mepe, which appears to be the hardest hit community, we have a stagnant pool of water that appears to be covering a significant portion of their land size. And this pool appears to be cut off from where the main source of water was from, that is the lake. And under this pool is livestock that are decaying because they I'm sure they couldn't escape the wrath of the flood. We also have cemeteries and pit latrines that have been taken over by the flood. So that is a lot of contaminated water that is stagnating. That is a very wonderful ecosystem for the breeding of all kinds of microorganisms. The water has begun to darken, and it is now giving off a very pungent smell in the community. And looking at it, before this recedes, that's millions of cubic meters of water. I'm sure before it recedes, it's going to take about a month to 6 weeks. So that is one thing that we should be thinking about. It's going to have dire health implications. So if there's a way that this water can be evacuated, water tankers pump it out, send it to safe areas where it can be discharged. I think that if there's a major operation in that regard, it's going to help. Because, like I said, people are still crossing this stagnant pool of water. One of the safe havens, St. Kizito, has been cut off. So, and we have more than 1,000 people on that safe haven, and they keep on crossing in and out. They are coming into contact with that water. Although safe water is being provided by all stakeholders, although we are emphasizing on hygienic protocols, sanitary and hygienic protocols, the exposure to this water is something that still poses a threat to us. And if something is done about it, it's really going to help.
So you say it will take about 6 months for this water to recede from the
4
area?
to 6 weeks. 4 to 6 weeks.
From 6
I'm
weeks?
sure. Best case scenario, depending on what...
4 to 6 weeks?
Yes.
But
that's what we've been told, for it to recede.
Okay, what's the health risk that this situation poses to the people who are there? This water that you have confirmed that is as we speak, has generated, giving out pungent, what you say, very serious pungent smell.
First of all, is the inconvenience to the survivors who are around. Imagine living by this particular stagnant pool of water. Now, we are also looking at waterborne diseases because of the contact that people will continue to have with this water. People may be forced to try and drink it because they don't have safe drinking water. Not all of them are getting, and I'm sure that there are efforts in place to make sure that everybody gets. Diseases like typhoid fever, diseases like cholera, which are epidemics, which can kill quickly and spread quickly, is one major threat that we are looking at. We are looking at diseases like yellow fever, dysentery. And if action is not taken, and if care is not taken, and some of these diseases happen, we are going to face a very massive public health threat. In addition to that, we also have vector-borne diseases like malaria. This and various stagnant water, breeds a lot of mosquitoes. And we are going to have an increased incidence of malaria if no intervention is put in place by way of mosquito nets. And we know that pregnant women and children under 5 who are part of the victims can be very vulnerable to malaria and severe malaria. Some of them can lose their lives. So those are the major health implications that we are looking at, in addition to the stress-related illnesses like hypertension and diabetes, which can be aggravated by the situation that the victims find themselves in.
When I visited you earlier in the week, you indicated to me that the cases of hypertension is rising because of the impact of the loss of property by some of the victims of this flooding. And it's still on the rise? We
have instituted measures. We have the Psychology Association, our mental health officers who are offering psychosocial support. And usually at the beginning, that is when it is more worrisome, because that is when they feel for the first time the impact of what has happened. Over time, when they are spoken to, and then when they see support coming, they begin to calm down. But when you screen every population, you are likely to also pick people who are known hypertensive clients but do not know. So because of this intensive focus on the people who are affected, especially those on the safe havens, we are also picking people who had these conditions but did not know. But like I mentioned to you earlier on in the week, some people who did not have hypertension, had no knowledge, did not have previous risk factors, all of a sudden had transient increase in their blood pressures. But for some of them, as we calmed them down, rechecked it, it's normalized. And we are continuing to monitor the situation and provide the necessary support to the affected population.
Do we have a public health emergency on our hands?
If there are no interventions put in place, certainly we are going to have a public health emergency. So we are on the alert at this point. And let me emphasize that this would feed into public health systems resilience. When we had COVID, we had the opportunity to build our public health systems over the 2 years. There's been a lot of investments into that by Ministry of Health, Center for Disease Control, Ghana Health Service. A lot of capacity has been built, the Korean government. So that afforded us the opportunity, for instance, to do our simulation exercise by July, when we had indication from VRA, and all the things that are required, the 4 key pillars, I would say, WASH, that is water sanitation and hygiene protocols being deployed, risk communication and social mobilization. We need to have a centralized command center to get them good information. One of the early things that happened during this disaster was people were fleeing, including health workers, because of wrong information that the dam was collapsing and the water was coming for everybody. So we need this centralized system. Every now and then you hear that there's an outbreak of a disease. Meanwhile, we, those who are monitoring the disease conditions, don't see any disease outbreak at this point. So it's very important. We're also talking about enhanced surveillance, making sure that we pick up every disease as early enough so that we can be able to isolate and manage it. We're also looking at case management. We are stockpiling medications. So with all these interventions, although the circumstances are rife for a public health emergency, we are doing everything possible with technical assistance that we are receiving from the Ghana Health Service headquarters and partners to avert it.
There was something that you mentioned earlier that made us all cringe, that there's a possibility that some of the victims of this flooding are consuming this contaminated water, or may consume this contaminated water that has developed this serious pungent smell as a result of the contamination by the fecal matter, and then also the decaying poultry and others that you've mentioned. That's a possibility.
Yes, certainly it is a possibility if we don't sustain the intervention over time. There's also the likelihood that, you know, the news cycle in this country, within a week, we move on to the next thing and begin to talk about it. And these victims will still be there. And we are all aware that this can take 4 to 6 weeks. So I am sounding this alert to let people know that it is very important for us to sustain the efforts that are in place now. When drinking water is a physiological need, and definitely people are going to have to drink some kind of water to survive, survival first. So if we do not continue to provide them with safe drinking water, yes, there's a possibility that they can depend on that water and try and purify it by boiling, which may very much be inadequate. Or they could use it for other things, like washing, or they could also be walking through the contaminated water, and also indirectly ingesting some of this water. So all those possibilities exist, and we should take steps to ensure that we don't get to that point.
Dr. Djokoto, so what do you need now?
Thank you. The first thing we need is a coordinated response. I've seen the influx of so many people who mean very well to the people who've been affected. But what I have to emphasize is that we have to have a central point to coordinate this. If not, there could be still starvation in the midst of plenty. There should be people who would ensure that, let's say, for instance, all those who want to assist, provide health care, they should get in touch with the district health directorate, who are doing a phenomenal job. And then they will deploy them to the various areas. In North Thong alone, we have 15 safe havens that are currently taking care of close to 5,000 people. These people couldn't go to their friends or families because they don't readily have some. So we should be able to coordinate to ensure that assistance gets to all of them. And all the partners definitely should be very much welcome on board throughout the long haul. Then we also have to ensure that we have adequate supply of logistics all throughout. We continue to review the situation. This is an evolving situation. So whatever resources you have to meet your projections might quickly change. So in as much as we are stockpiling, I'll still continue to appeal to all to continue to prepare towards supporting. You can always contact the Regional Health Directorate. We are ready to offer all the technical assistance, and we need a lot of encouragement at this point. We have the health workers who've been on the ground, sleepless nights, doing everything possible to avert any possible health crisis, and they should be supported in so many ways. We've had over 100 health workers who are displaced. We also need support to be able to resettle them so that they can continue to deliver service. We want to make sure that we sustain the delivery of essential health service. So all those who can support with any kind of logistics, be it thermometers, be it SFIC. At this point, we know that we will need more than the usual that we have. So if we get any kind of assistance from internal stakeholders, external stakeholders, that would be very helpful.
Very important detail and that clarion call that you make as well. And for us here at Media General, we're also putting together some support for you as well. And so we would come to you. This is the mobile money number that a number of you have been sending your little contributions to. So please continue to do that. 059-7433-110. 059-7433-110. The reference should be Akosombo. So please keep them coming. The merchant number 120494. 120494. I've already started receiving some pledges from here as well. So really thank you all for this. Dr. Senanu Kwesi Djokoto, Deputy Director of Health Services in the Volta region. Thank you so much for making the time to join us.